begged and pleaded for them to give my mother medication. Why do I need to do that? Why are they taking my mum's liberties away from her? Because she's 76 years of age, she's denied the right to live.
Jean Wingate was taken to the Queen Elizabeth University Hospital with suspected pneumonia. Her daughter Roseanne says the family were asked at that stage to sign a Do Not Resuscitate order due to her mum's age and because she had COPD, but they refused.
A consultant called and said not to be overly concerned because if it was COVID, there was an 80% chance that my mother would be okay. So why are they so insistent that I should sign a DNR for my mother, who was 76, who was healthy? She lived on her own, she was able to look after herself.
Jean was later diagnosed with COVID. Again, the family refused to sign a DNR, but Roseanne says doctors also told her if her mother's breathing got any worse, she wouldn't be given a ventilator. Sadly, Jean passed away just 2 days after being admitted. The family say they need answers.
I'm not sure if they worked on her. I don't know if they had put a DNR in place, because they told me that if I didn't sign it, that they would take it out of my hands and medically they would sign it. I don't know the reasons why, apart from she was elderly and she had COVID.
The Do Not Resuscitation form seems to be acting like a tool to almost write some people off before they give them a fighting chance.
Age Scotland is calling for a parliamentary inquiry into the handling of Do Not Resuscitate orders. The charity says it's received more reports of concern around their use this year than any other.
This is something which seems to have organically grown across Scotland back in March and April, and has only sort of come to light after people have been raising their hands and saying this doesn't seem right. So we were able to get to the bottom of this, work out what's been happening, why it's been happening, and who started it, actually, because it's originated somewhere. The practice is wholly wrong.
Meanwhile, NHS Greater Glasgow and Clyde is now investigating the circumstances surrounding Jean's death.
In terms of any patient care plan, it's devised and put in place with respect to that patient, what their underlying health conditions are. Age may well be a component to that, but it's a web, it's complex, it's taken very much on those patients' individual circumstances.
The Scottish Government says there has been no change in the use of DNRs in response to the pandemic and stresses no one should feel pressured when discussing treatment options. Kirsty Clark, STV News.